So, madam, I'd like to meet you on camera, your name and designation.
Okay, I'm Dr. Bolanle Hadegboyega. I'm a radiation and clinical oncologist with LUTH and also a member of the Association of Radiation and Clinical Oncologists of Nigeria, HACON.
Okay. So, basically, yeah, World Cancer Day is already right before us. So, we'd like to know um, those key things Nigerians should know about cancer.
Well, presently, cancer is more of an endemic condition in Nigeria in the sense that the incidence, the cases we're recording is increasing, whereas the mortality, the death from heat and the disability from heat is also increasing. Basically because in Nigeria we don't have enough equipment and other treatment modalities to combat it. Generally, cancer is a disease in which a cell becomes to grow abnormally and does not know when to stop growing, unlike in normal cells. There are some causes of cancer that can be preventable, some causes are modifiable, you can work around it, whereas some causes are not modifiable. Cancer, there are like over 100 types of cancer, and every cell in the body from the crown of the head to the sole of the feet can be cancerous. So we can actually have cancer of the scalp, you can have cancers of the toe, but there are some common cancers in Nigeria generally. Like in women, we have breast cancer is very common, followed by cervical cancer, there's colorectal cancer, and then gastric cancer or lung cancer. Whereas in men, the commonest cancer in men is prostate cancer, there's also colorectal cancer, there's lung cancers, and then other head and neck cancers. Some causes of cancers that could be preventable basically is due to lifestyle. Maybe in these cases they actually reduce the risk of developing cancers, like smoking and alcohol. Cutting down and stopping these ones can actually prevent lots and lots of cancer, because up to like 80% of cancer is actually associated with smoking and taking alcohol. Obesity is also a major cause of cancer, such that if you eat elderly, a diet that is full of fruits, that is rich in vitamins, that is full of vegetables, can actually prevent cancers like colorectal cancers. Then when you cut down some fatty food, it also helps to prevent some cancers. Then obesity is also found to be involved in breast cancer or endometrial cancer and some other cancers like that. Then living healthily include exercising. With a lot of exercise, it cuts down your weight and then also prevents some cancers. Whereas some causes of cancers cannot be helped. Increasing age is a major factor. So that is why we found that cancer is actually common in some in elderly as the age is increasing. And in this case, there's really nothing one can do about that. And then because of the longevity of life, as the age life expectancy increases, the risk of developing cancers increases, and the more we imbibe the Western lifestyle, it also increases our risk of developing cancers. The major thing about cancers, the major way that we can prevent cancer include early screening. Okay, like I said, also family history. There are some cancers that runs in the family. In this case, so you can't help it. Like breast cancer has a family history, colorectal cancer, ovarian cancer, prostate cancer. These cancers runs in family. So if you know your family history, that is when it leads to screening. So generally from age of 40 and above, then depending on who in the family and when they develop it, can tell when you can start screening for cancer. And with early detection, some of these cancer are actually can be very curable. Breast cancer, there's a screening for breast cancer, includes mammography. Then in cervical cancer, there's pap smear to screen for cervical cancer. Prostate cancer, PSA screening also helps in screening for prostate cancer. Essentially, if you detect cancer early, you'll be able to treat early, and then it can actually achieve a cure.
What is PSA?
PSA is prostate specific antigen, is a blood test that is taken in men to check, detect. The normal is usually between 0 to 4, and when it's elevated there are some other causes depending on it, and it can actually be a pinpoint to someone that is at risk of developing cancer or someone that has a cancer.
Okay. So, I think basically you've really said all I need to hear. Is there any other thing you want to add?
Yes, I want to talk about the treatment of cancer. Treatment of cancer includes, okay, treatment of cancer is a multimodal approach. That is, several specialties of doctors are involved. There's a surgical part of it. Some of them require surgery. There's chemotherapy. It's a combination of drugs that is used, and it goes around the whole body. And there's radiotherapy. Radiotherapy is like a form of an X-ray machine that is used to treat that is used to treat cancer. It's a local treatment. It only affects the area where it's focused to. Other forms can include hormonal therapy. There is also targeted therapy. In all these ones, we have virtually the others, but the radiotherapy part of it is actually very deficient in Nigeria. Presently, we have like 2 or 3 machines functioning in the whole Nigeria, and then thanks to God, Luth machine is going to come up very soon. But it only tells you the problem our patient has to pass through. After detecting that they have cancer, some of them may not get treated because there's no functional machine and it delays their treatment, and some of them, we are losing most patients to this one. So we really advocate to the government and some public-private partnership to help in this. Like in Tanzania, treatment of cancer is actually free. NHIS is covering some costs, some treatment of cancer, but they need to do more. It has to come to normal to every man, and then the more people get treated, because treating cancer is very expensive, such that even with health insurance, people know what they pass through. So we need more advocacy on the part of the government to make the treatment free or as accessible or cheap as possible. Then then we need more machines such that is accessible to the patient. Then with that, we can start cutting down the mortality and then have more success story. But presently we have survivors, but we can do much better, much more. Thank you.
Yeah, thank you. Yeah. From my own knowledge, if you still help me, radiotherapy is fishing out the cells through the radiation.
No. Radiotherapy is a treatment using radiation to treat the cancer cells. So what I mean is that it's unlike chemotherapy that travels around the whole body. Radiotherapy is a localized. It's only targeted to a particular place where there's cancer cells. Fine, it affects some normal cells, but these normal cells grow back with time, they recover. Whereas the cancer cell, if it's properly planned, they are taken care of and killed. It can be used after surgery. It can be used as the main treatment. It can also be used in combination with chemotherapy to treat cancers.
So please explain chemotherapy again to me.
Chemotherapy is a form of injection or tablet that is used to treat cancer in this way, because he take it either through as an injection or as a tablet. It goes through the bloodstream and moves around the whole body. It's a form of is an anti-cancer drug. Chemotherapy are anti-cancer drugs used to treat cancer, but because it moves around the whole body, it affects normal cells, and it also kills cancer cells. But the good thing is that normal cells have ability to recover speedily. And so when the patient is well prepared, like when you want to when anybody that wants to take chemotherapy, we prepare them. Then we do some basic tests to know what is safe for who. And so when all these precautions are there, and it's also is in cycles, such that the normal cells would have recovered, people would have gotten over the side effects before they take another cycles. So with this one, unlike the myth or the negative report about chemotherapy usually doesn't kill. If it's well done, it should not kill, whereas it's cancer that kills if not treated.
Okay, so in the last thing, surgery is the last, as in,
no, surgery usually comes first, because surgery is used when the cancer is still operable. It means that it is small enough and it has not spread. Cancer has a tendency of spreading to every other part of the body. It can start from the breast, it can go to the lung, it can go to the liver, it can go to the bone, it can go to the brain. So but when it is still early disease, that is when surgery is applicable for a disease that is still early. So it usually comes early in the course of the treatment.
Thank you very much, madam. Thank you. Sorry, 1 second ago. Oh, are you still taking shots?
No. 20%. So it means that if you do the 5, the chance of cure is 100. So some say that, okay, now you cannot do surgery again. Like in breast, anybody that cannot do surgery most likely will not need to only do radiotherapy after surgery. So it shows that person has lost 20 vital treatments
say we only be left